now we have United Healthcare. And Tara's going to tell us a little bit about how things are changing for United's ACA plans this year. This is their second year back in the marketplace. We're really excited to partner with them. Following this presentation at 1 o'clock Eastern, we'll hear from Molina. So everybody sit tight. We'll probably try to hold all questions and answers until after Tara does her presentation, but sit tight and we'll get to them all. Tara, take it away.
Great, and I confirm you do see my welcome slide, correct?
We sure do, and we hear you perfectly.
Wonderful, thank you. And thanks everybody for your time. We are obviously really excited to return again for our second year, and we're hoping you guys are as well. Our goals are going to continue to be set for new expectations of the value that individuals and families are bringing and providing reliable and affordable coverage to as many people as possible. But we obviously can't do that without the help of you guys. Over half of our growth has come from brokers such as yourselves. So we do really value you. And one of the things that you're going to continue seeing with us is this you and United Healthcare. Over the next 40 minutes or so, we're going to go over some footprints. We're going to talk specific to just a couple of states. We really don't have time to go through all the states, so we're going to target a couple. Talking about a little bit of our product portfolio, some new plan designs, enhancements, and also some of our sales support tools for you as our agents. So our agenda today, we're going to go over our 2023 footprint, including 4 new states, and then kind of talk about some expansions in some of the current states. Talk about our provider network with key providers and hospital systems. Discuss some of the product offerings with updates and enhancements. Talk about the member experience that we want your clients to experience. And last but not least, of course, the different agent tools that are designed to help you not only sell our individual and family plans, but also assist your clients every step along the way. And one of the things you're going to hear a lot with us as well is when we talk about the United Healthcare individual and family plans, you're going to hear the reference a lot of IFP. Okay, so that just stands for individual and family plans. So let's get right into the footprint. For the 2023 year, our footprint is going to grow to 92 markets across 22 states and hitting 549 counties, which does contain 7 million consumers who are eligible for marketplace plans. The 4 states that we are expanding into, which are new this year, are going to be Kansas, Missouri, Ohio, and Mississippi. And then we'll also highlight some of the states where we'll be expanding that we're currently in. So I'm going to again say it again. It's really important. Over half of our growth nationally came from brokers like you that are attending and watching this information today. So market expansions, as we mentioned, the 4 new states. When we look at Ohio, we're going to be hitting the Cincinnati, Cleveland, Dayton, Toledo, and Youngstown areas, partnering with very specific health systems. Kansas and Missouri, when we hit the Kansas market, we're hitting the Kansas City on both sides and Wichita. And then St. Louis, Joplin, and Springfield in the Missouri market. And then we'll be partnering with St. Luke's and Encompass Medical Group in Kansas City. Mississippi, we're going to be targeting Jackson, Gulfport, Biloxi, Hattiesburg, and Tupelo, and targeting very specific health systems as well. We talk about existing markets, and we discuss our expansions and our adjustments. I'm not going to go through all this. A lot of this information, I want to point this out, that you guys are going to have access to with United Healthcare will be available through Jarvis, and will also be available if you need assistance through our producer help desk. So when we discuss Alabama, Florida, Georgia, Illinois, Louisiana, Michigan, Tennessee, Arizona, and Texas, these are expansions that we are making with adding additional markets, and then kind of talking about who are the different health systems that we are partnering with. So our network that we use for the IFP plans, it is built specifically for the IFP population, really focusing on affordability and accessibility, is what was used to help design it. So this network is separate and very distinct from any other networks with UHC. So if you're selling the other products with UH1 and you're used to the Choice and Choice Plus networks, this is very different, and it is a completely separate provider lookup, and this is going to be solely for the ACA plans. So your IFP customers, we've learned, are highly price sensitive, and a lot of people are buying competitively priced plans. So the IFP network objective when we did this is to achieve network rates, which enables, of course, competitive premiums for your consumers. So it all goes hand in hand. Your IFP customers want their doctor in network and access to other services and facilities. The IFP network objective is really to build networks that include an attractive set of providers and facilities, which is going to help address all different sorts of care services. So let's take a closer look at some of, as I mentioned, we're going to target a couple of states today. We're going to first focus in on Florida. So as you can see here, the rating areas that we are going to be targeting are going to be Cape Coral, Fort Myers, Naples, Deltona, Daytona Beach, Ormond Beach, Miami, Fort Lauderdale, Northport, Sarasota, Bradenton, Orlando, Palm Bay, Melbourne, Titusville, Pensacola, Tampa, and West Palm Beach. So we've added additional counties this year because really our goal is to provide, of course, quality health care to all of our members. We've partnered with key provider systems with a direct focus on value-based care. This is going to allow for quicker referrals and a higher level of quality of care. So in Lee and Collier, we've partnered with Naples Community Health System, North Collier Hospital, Lehigh Regional, and Prime Healthcare Services Group. In Hardy, Highland and Polk, we're going to partner with Advent Health and HCA, which is going to include Highlands Regional and Lakeland Regional Medical Centers. In Brevard, we have the Stewart Healthcare System, which consists of Melbourne and Rockledge hospitals. And in Manatee, we have Blake Medical Center, which is part of HCA and the University Healthcare Services System, which consists of Manatee Memorial and Lakewood Ranch Medical Hospitals and providers. Texas is another state that we wanted to note here. Again, we've expanded in this area, 32 additional counties for 2023. A lot of information, but again, these state maps are all available to you guys in Jarvis. Jarvis is going to be your friend. You are going to hear that referenced a lot. Use your Jarvis portal. Use the producer help desk. These are going to be extremely valuable resources for you guys when wanting to know plan designs and product offerings and providers within certain areas. So excited to share product updates with you. For plan year 2023, we do seek to focus on really the fundamentals of affordability and core benefits while adding enhanced extras to really kind of meet the needs of a wide range of consumers. So really our overall strategy this year is to build on trying to maintain the competitive premiums to be competitive in an extremely price sensitive market, bringing lower deductibles and copays where possible and expanding the use of copays versus co-insurance, expanding the access to $0 cost primary and virtual care. We want to expand access to low-cost generic drugs, expanding the member incentive program that we have that I'll get into in just a bit, and then also increasing plans that offer adult dental and vision. So I'm going to show you a short video here. Sometimes the sound does or doesn't work. The sound is just music, so really just kind of gives you an idea with some of the enhancements and things that we're expanding on. Okay, so one of the things you guys are going to notice also that it's going to be pretty consistent with United through the open enrollment period is we're going to talk a lot on strength and we're going to talk a lot on stability. And that's one of the things that we've really kind of took into account when we started looking at enhancing our benefits by offering the no-cost virtual urgent care, no-cost primary care. So many of our plans will have a $0 copay for PCP visits in person, offering low-cost prescriptions at Walgreens, so $3 or less for Tier 1 and generic. Walgreens is our preferred partner. Also increasing our member reward from $25 to $100. And then we're also going to continue to offer that complimentary one-year Peloton Fitness app membership as well for each person that is on a policy with us. We are going to continue to offer our essential, value, advantage, and virtual first products in 2023. The essential plans are typically low to no cost, post-tax credit with fewer extras. So for 2023, we've added prescriptions at $3 for preferred generics to all essential plans. Now, the value plan is our go-to, kind of our flagship plan. It is offered across all metal levels, targeted to be our lowest or second lowest price in both silver and bronze metal plans. And then the Advantage is one of the richer plans. Some include dental and vision coverage. And for 2023, we are offering two types of Advantage plans. One is going to be an all copay plan with a small deductible, and the other would be a zero deductible plan. And Virtual First, a very, very popular plan with us. We do continue to offer 24/7, $0 on-demand comprehensive virtual care at your fingertips, and that is accessed via the Galileo mobile app, same as last year. Again, we can't say it enough. For 2023, we are offering $0 cost primary care on most plans. Virtual First members do receive $0 cost virtual care as well, again, through that Galileo app. And we're simplifying virtual care, the benefit through Optum. It was formerly Amwell, offering free, unlimited virtual urgent care on all IFP products. So I'm going to say that again. Free, unlimited virtual urgent care on all products. We're also enhancing member experience, for example, the integration within the My UHC app. So let's learn just a little bit more about that as far as plan details. Again, what I'm going to show you here on this benefit grid, this is all going to be available. These plan grids are available to you in Jarvis. I would suggest getting out there, get familiar with it. I am not going to go through all this information that's on this benefit grid. It is a lot of information. You have this at your fingertips by simply getting out and utilizing this. So this is going to be a valuable piece of information, to help you with your shopping, or give you these sell sheets for this year. Again, in Jarvis, which is your agent portal, you can download these sheets, you can save them, you can customize them by plan, by state. You can review deductibles, max out-of-pocket amounts, member cost sharing where it's applicable for primary care specialists and hospital. And as you can see, most plans, again, are that $0 copay for primary care visits, with a few exceptions. On the second page, you're going to find additional plan details such as the pharmacy benefits, which plans include adult dental and vision, which ones include free virtual urgent care, which plans include the popular Walgreens discount program, the Peloton app membership, and again, the $100 member incentive that is offered on all plans. So we do continue to offer this virtual first plan design. It was very popular last year. Customers do have convenient 24/7 access to care and same-day response for all $0 copays. By far our most popular plan in Florida and many other states. So no surprise bills for care access through the mobile app. And very important, in Florida, we will now have end-to-end Spanish-speaking experience with Spanish-speaking physicians as well on the virtual first plans. So all services and referrals are coordinated, again, from the Galileo PCP. So it's the PCP that is chosen through that Galileo app. Virtual and app-based care includes urgent, everyday, and chronic conditions like cold and flu, stomach pain, hair loss, prescriptions, diabetes, hypertension, insomnia, really just to name a few. So when we talk about the member experience, at the end of the day, they are why we do what we do. And our mission from our end is really to make their experience with you plus United Healthcare the best that we can. So our 2022 campaign is really designed to connect consumers with United Healthcare and our unique IFP value proposition. We want to help create informed, independent consumers that trust United Healthcare as a partner for their affordable quality coverage designed really to put them first. So based off of our experience last year, we developed, tested, and validated a campaign platform focused on showing consumers that United Healthcare IFP plans are the trusted leader in the space. We are able to meet the unique needs of each member. Our campaign is designed to educate consumers about plans offered by United Healthcare, really as a more human brand, ready to lend a helpful hand to those who need it. So how are we doing this? How are we getting the message out? First, we are increasing our value by increasing member incentives from $25 up to $100 for 2023. That means members who complete 4 easy steps are then eligible to receive a $100 gift card from either Amazon, Walmart, or Walgreens. And just kind of as an FYI, Amazon does receive about 60% of the overall program redemptions. Next, we are continuing to offer the digital fitness option with Peloton. Members who already have a Peloton All Access membership can activate the benefit for a 3-month credit towards their existing account. And all IFP members have access to that free 12-month Peloton app membership. This is the digital app, okay? Finally, we're now offering an AARP membership to all IFP members to gain access to the ARP discount program. That includes discounts on travel, groceries, different resources and tools for financial planning and healthy living. It's a great benefit designed to help your members save on items they use, and enrollment is super easy. Just enter the promo code on the website and let the savings begin for your client. We will also have ongoing strategic touch points with your consumers, really to help them understand the process for renewing their coverage with UHC and understanding the value and strength and stability as they make important decisions for their plan year of 2023. All of this is designed to educate your members on plan improvements through different personalized highlights important to your members and help drive engagement in preparation of renewing for 2023. So when we talk about engagement, let's take a little look on how we will focus our marketing and branding efforts during this You Plus United Healthcare campaign. We've learned a lot about the exchange consumer this past year. For example, urban entrepreneurs or rural part-time workers are consumers that understand and know what their health needs are, and when it comes to health, they feel responsible for their own decisions. Our IFP consumers are self-reliant, but that doesn't mean that they aren't seeking advice from you as the broker or healthcare providers or friends, family members, or even social media. They want to make an informed decision about their healthcare, and they're going to utilize any means necessary to understand their options. Having an insurance plan that can meet them where they are with their unique lifestyle makes it easier to move through life with confidence with the United Healthcare products. So this is where You Plus United Healthcare branding is really ready to help meet your customers where they are, wherever they are in their journey, really. Just like the goal is to make informed decisions, our goal is to help them become informed, independent consumers that trust United Healthcare as a partner for affordable quality designed to help put them first. Everything from digital, social print, and transit will now speak to them and their needs as they look for a brand that will be with them throughout their journey. And we understand the value of you, the agent, in this journey as well. So that's why we're working hard to implement tools that you can use to assist your members through the selling process and beyond. We're going to continue to use Jarvis as the agent portal for your business. Many of you are already familiar with Jarvis and its functionality since you are using this for your Medicare and or your ACA business with United Healthcare now. If you're not already using it, make sure you reach out to the producer help desk for assistance. They can use use the phone number or the email that you see listed here. And again, producer help desk and Jarvis will be lifelines for you guys. Jarvis is where you access your book of business, member information, and the agent toolkit, where you can download shopping sheets you saw in a few earlier slides. We're also excited to share with you that we are bringing even more functionality to Jarvis to make your job even easier. You asked, we heard. This was one of the biggest things. You will see increased functionality in several areas, including assisting your members by being able to retrieve a member ID card directly from Jarvis for your members. You will also be able to set up member payments through a link at the end of the Health Sherpa enrollment, which helps you and your member pay not only the binder payment at the point of sale, and you can help set up reoccurring auto payments as well. Also, as part of the early pay experience, you can also select a PCP at the time of sale, or if changes need to be made before the effective date and 30 days after, you can assist your member through the myuhc.com website. And coming soon, you will be able to check application status just like you can on the Medicare side for your ACA members. So a final version is going to look similar to this from what you see here. So kind of stay tuned on that portion. Along with increased functionality, there's also an increase in materials coming your way, including more customizable pieces that are going to allow you to add your contact info, social media ads for your websites, and additional messaging such as shopping sheets and flyers with more variable headlines. So all of this really is designed to make you plus United Healthcare a team that your customers can count on. As I mentioned, Producer Help Desk is here to help you. Take down this information, phone number and email. This is going to be an extremely important tool for you. They can support you with questions on contracting, sales support, application status, commissions. So if you're using the Producer Help Desk for answers on the fly, your clients, they're going to have a good experience with you and your business, and it's going to help you accelerate towards your highest potential. United Healthcare is growing in the IFP space, and we want to make sure that you guys are also growing with us. As an IFP agent with us, we'll help you stay informed of current happenings through our Connect newsletter, as well as up to date on our products and systems through our on-demand training portal. So be on the lookout for more information coming your way soon. Commissions are processed twice weekly. Once members pay the first month premium, you are eligible for a first month commission. Your commissions will be based on your current year renewal rate for all business, not just new business. You can locate specific commission information again on Jarvis. So for more information on state-specific commission amounts, please refer to your current contract for those different commission schedule details. Last but not least, we are going to have a broker trip. Be in our top 30 brokers for IFP or your ACA business, and there will be a trip that is going to be held at in Playa del Carmen for you. Further details to come on this, but this incentive is going to run November 1 to March 1 of 2023. So you definitely want to be in the top 30 as it pertains to your ACA business. So with that, Steve, I'm going to turn it back over to you. And hopefully this was getting you guys a little bit excited as we start approaching the 2023 open enrollment period. And that is all from my end.
That's great. Thanks, Tara. There's a few questions here I'm going to pose to you in reverse order. It'll be easier for me. For the AARP membership, do your members have to be age 50 and over, or is everybody eligible? Tara, you still with us?
Oh, yep. So apologies, I was on mute. So no, there's no age limit. Everybody's eligible, just as they are all eligible for that Peloton membership as well. So if it's a family of 4, all 4 of them get that membership as well.
Okay, super. And can somebody choose a virtual first plan and choose a regular doctor as their PCP rather than use the Galileo chosen PCP?
No, the virtual first plan is designed to be all virtual.
Okay.
They aren't typically having the ability to choose
Mhm.
their current PCP. And unless their PCP is a participating provider
Right.
through the Galileo app,
Mhm.
then they could potentially, but that is not a guarantee.
Right. But once they select or they've been assigned a virtual PCP, and this is for the virtual first, not the virtual urgent care, they typically stay with that PCP throughout the year. Is that correct?
Correct.
Okay. And by the way, just for our audience, that's the benefit of having a virtual PCP as opposed to virtual urgent care, where you're looking for a physician to help you out with an urgent matter, within, depending upon how that works out, certainly within 12 hours or fewer. But on a PCP, it might take a day or two to get the PCP, but you're always seeing the same person. So they are familiar with your medical conditions and experience. Somebody asked about the Virginia network. I don't know if you covered that.
We did not talk about Virginia. We just hit Florida and Texas today. We can certainly compile the different state maps if you feel that having all of them. Otherwise, use Jarvis. Jarvis is going to be a great tool. Those state maps that I showed for Texas and Florida are available on the Jarvis portal.
Perfect. And also in regards to network, is Ochsner no longer a participating provider?
In what particular state? I would have to look because as you've seen, those state maps there's a lot of info on them. So Oscar, in what state? Florida, I'm assuming.
It's Ochsner, and I don't know, but I would suggest to Gina that she check that out on Jarvis.
Jarvis. Yep, absolutely.
I'm on a call. Thank you. Okay. Let's see. Is UHC ACA available in Clark County, Nevada?
Again, I'm going to refer them to the state maps that are available on Jarvis. I would have to take a look and see if they are within that. So, I mean, I can peek if you want to hop to the next question.
Let's see. What is the difference between first virtual plan versus $0 virtual urgent care? Do you want to address that again? So the question is, what's the difference between virtual first and virtual urgent care? And the difference, as I understand, is virtual first means you're going to be assigned a PCP, and that might be your first route before you go see a PCP in the office. So if you've got perhaps a minor chronic condition, you want to go back and see the same physician multiple times throughout the year online, that's a virtual first means. I've read stats to say that over 90% of the things that we see our primary care physicians for do not require an on-site or in-person visit. So it's a great way of being able to, it's a great way of being able to reduce cost overall, but also increase convenience for yourself. As opposed to virtual urgent care, which is, your child wakes up at 2 a.m. with a terrible ear infection, or you've got a rash, or you're suffering from something that is not urgent, that requires an emergency room visit, although they may triage you, but that you do want some immediate attention, and it's not going to wait until you can get in to see your PCP. Does that sound about right?
Yep. That sounds great. Yes. Yep.
Okay. I think that answers all the questions. Anybody else?
Like I said, make sure you're utilizing Jarvis if you're talking specific state things, or if you're looking at specific product things. You're going to have those benefits and sell sheets out there, as well as the state maps showing you the counties and the different hospital systems that are going to participate. So you may end up getting sick of hearing us say that, but that's really going to be a great go-to for you guys is Jarvis and the producer help desk.
Oh, looks like we've got a few more questions popping up.
Okay.
Do the virtual plans provide a patient hospital care? I'm not sure I understand what that means.
Maybe they're asking
Inpatient hospital care.
If there's a confinement benefit.
Yeah, but it seems contradictory to me. Inpatient hospital and virtual care.
On a virtual, exactly. Because I mean, and I haven't had a chance to take a look at all the nuances of the virtual first for this year, but really the design of that virtual first plan is to be your virtual healthcare provider coverage.
Right. Okay. Can you repeat the ACA broker support email address? I happen to have it here. It is ACA broker support at UHC.com. ACA broker support at UHC.com. And when I use Jarvis, it only mentions Medicare in training. Is that something?
Okay.
Go ahead.
So if you are logged into Jarvis, it should be on the top right side. There should be a toggle to go between Medicare and ACA. So double check and make sure that that's there. And then, we could also double check and make sure everything is set to go with your contracting as well.
Great. And these questions just keep pouring in. Since UHC is in many states, if a client travels to visit family in another state, will the member be covered nationally?
Most networks in each state are going to be HMOs. So a lot of there are going to be a few states that are going to have contiguous coverage, like Kansas over the line to Missouri, Missouri over the state line into Illinois. There's going to be some contiguous coverage, but by and large, most of them are HMOs.
So we're talking about coverage for emergency care only.
Right.
Otherwise, everything would be out of network.
Yep.
Okay. Let's see.
Yeah, it's different than what people have been used to with maybe the Choice and Choice Plus network on the UH1 side. This is a whole different network.
Right. Okay, perfect. I think that. Oh my gosh, more questions are coming in. Is this? Oh, that's for me, which I'll address later. Where do we toggle for ACA, AHIP? That's something else. Is that on Jarvis?
I'm not. Well, if they're talking Medicare and ACA, when you're in Jarvis, it should be up on the top right side of your screen. You should see. I don't know the exact verbiage if it says Medicare and ACA or Medicare IEX or IFP, but you should see it. You should see it on the top right corner of your screen. Okay,
great. And maybe you can interpret this one better than I can. It says continuous coverage that they can use in 2 states or all states?
Oh, contiguous. So it offers, in some states, it offers cross-county line coverage. It's contiguous.
Right.
Yep.
Okay, I think we'll wrap up. Oh my gosh, one more. And then we're gonna wrap it up.
Okay, and if anything else comes up after this week, you can certainly collect them and you can send us an email and we can address them, no problem.
Sounds like a great plan. Everybody's got that email address. Tara, thank you so much for all the information on United's IFP plans. Really, really appreciate that.